to this recorded presentation of functional foods and nutrition supplements for cancer patients. I want to give a brief introduction to myself and cancer survivorship. And I also want to introduce to you our oncology nutrition team that we have here presenting. So my name's Amy Blanc. I am the Survivorship and Supportive Services Initiatives Manager. And to introduce what survivorship is, in case that's a new term for you, cancer survivorship really begins at the point of a patient's cancer diagnosis. And it's firmly rooted in understanding and providing care that supports you, which is about recognizing how cancer and its treatment affects you and your ability to go about your life as you like, helping you live with cancer meaningfully. And classes like this today really help support this effort. We encourage you to check back to the Intermountain Classes and Events website that you use to access this recording, because we do add new content and classes quarterly, specifically for nutrition. And you'll also find other offerings that we may have near you, such as cancer-related support groups. So with that quick little introduction about cancer survivorship, I really want to turn it over to our two dietitians. So please let me introduce to you Angie Hansey and Maddie Anderson. Take it away.
Great, thanks for that introduction, Amy. I'll just briefly introduce myself. My name is Angie Hansey. I am a bone marrow transplant dietitian, and I work at LDS Hospital, and I've been here for about almost 5 years now.
I'm Maddie Anderson. I am also a dietitian here at LDS Hospital. I do a little bit of kind of everything, but I do spend a decent amount of time working with our bone marrow transplant population and just our general medical oncology population. And I have been here for about 2.5 years.
So as Amy already mentioned, we are going to be talking about functional foods and nutrition supplements for cancer patients. So to start, I'm going to talk about some objectives for our presentation. The first one is explain the concept of functional foods and how they can benefit cancer patients by providing essential nutrient and improving overall health. Then discuss the role of nutrition supplements in addressing potential deficiencies and enhancing the well-being of cancer patients. And then highlight evidence-based research and studies that demonstrate the effectiveness of functional foods and nutrition supplements in improving quality of life for cancer patients. I'm going to start by doing a quiz, just a couple of questions. The first question is, what is the goal of functional foods and nutrition supplements in cancer care? Is it A, to directly treat cancer and eliminate it? B, to alleviate side effects of cancer treatment and support overall well-being? Or C, to replace conventional cancer treatments like chemotherapy? Let's give a couple minutes to think, or a couple seconds to think about it. So the answer to this question is B, to alleviate side effects of cancer treatment and to support overall well-being. They're not used to directly treat cancer and to eliminate it or to replace chemotherapy. The next question is a true or false question. It is, it's better to supplement things than to eat because we want to make sure we're getting all the right vitamins and minerals. Is this true or false? So the correct answer to this one is false. We do not want to use supplements as a replacement for real food. So I'm going to start by talking about functional foods. The Academy of Nutrition and Dietetics defines functional foods as whole foods, along with fortified, enriched, or enhanced foods that have potentially beneficial effect on health when consumed as part of a varied diet on a regular basis at effective levels based on significant standards of evidence. Just a little bit of background about it. Through the mid-20th century, foods were primarily valued for their ability to satisfy hunger, provide energy, and help children grow into strong and healthy adults, and also provide vitamins and minerals indispensable for life. These goals were achieved by consuming adequate amounts of energy, macronutrients, and micronutrients naturally present in a varied diet. The realization that food provides an additional layer of bioactive compound surfaced in the second half of the 20th century. Functional food was first defined in the 1980s in Japan, when the nation's government sought a food-based system for improving health and decreasing the rising incidence of chronic disease. The Japanese government encouraged its population to consume for functional foods, hoping this would lead to a natural improvement in overall diet and in turn, better health. Japan defined a food as functional if it provided basic nutrition, a positive sensory or satisfaction experience, and physiological benefits. Their government used a food labeling system to identify such foods, which mirrors what we have here in the United States called the Dietary Guidelines for Americans. So I'm just going to talk briefly about the Dietary Guidelines for Americans. They were first created in 1894 by the US federal government to establish a scientific basis for human nutrition. They are used to provide dietary advice that would improve the health of Americans and reduce their risk for chronic conditions such as cancer, hypertension, heart disease, stroke, and atherosclerosis. A healthy vegetarian and Mediterranean style eating pattern, which is outlined in the dietary guidelines, are consistent with research regarding functional foods and nutrition supplements. In the guidelines, it reports that 80% of American population has an eating pattern that is low in vegetables, fruits, and dairy. Therefore, Americans who consume inadequate portions of these important foods are missing out on many cancer-fighting nutrients. There are some main areas of the dietary guidelines, which include that dietary patterns should shift with each stage of life, enjoy rich foods and beverages that adhere to one's budget and reflect one's personal preferences and cultural traditions, to meet food group needs and stay within calorie limits, focus on nutrient-rich foods that provide vitamins and minerals with little added sugar, saturated fat, and sodium, and to limit added sugars, saturated fat, sodium, and alcoholic beverages. Next, I'm going to talk about phytochemicals and nutraceuticals. If those who watched Lacey's presentation before this one, she kind of touched on this topic as well. But this is a term that is used interchangeably and are the bioactive compounds that are found in functional foods that are known to modulate metabolism and health. Furthermore, phytochemicals and nutraceuticals are known to have antioxidant and anti-inflammatory-like components that offer protection of certain diseases. Some examples of phytochemicals and nutraceuticals include carotenoids, polyphenols, flavonoids, isoflavones, and etc. These bioactive compounds within plants influence every stage of carcinogenesis and have the potential to slow its initiation and progression. It is known that the majority of cancers are influenced mainly by modifiable risk factors, and that includes diet, which is where these functional foods have an important role. Next, I'm going to talk about some specific functional foods, but before I do, I wanted to add a disclaimer that not one single food can prevent or cure cancer, and all recommendations discussed today are general recommendations and information regarding functional foods and nutrition supplements. It is highly encouraged that you talk to your doctor and dietitian to see what diet is most appropriate for you. The first functional food I'm going to talk about is fermented brown rice and green banana flour. Food manufacturers were adding fermented brown rice flour and green banana flour to their products to increase whole grain contents of otherwise refined breads and other refined flour products. It helps prevent DNA damage in cells while also moving digestive contents through the gastrointestinal tract faster and preventing changes to the intestinal mucosa that are favorable to the development of colon cancer. Next is flaxseed. And flaxseed is a primary choice for a functional food ingredient. The brown-seeded flaxseed is grown in Canada, and the yellow-seeded flaxseed is grown in the United States. Flaxseed is the best non-fish source of omega-3 fatty acids, known as alpha-linoleic acid. And for those that do not know, omega-3s are a type of fat called polyunsaturated fat. They are an essential nutrient, meaning that you need to get them from the foods that you eat. Your body does not produce them on its own. Omega-3s are anti-inflammatory and indicate that getting an adequate omega-3 fatty acids can protect against various illnesses, including cancer. Flaxseed also provides both soluble and insoluble fibers, which is good for the GI tract, and that includes lignin, which has phytoestrogen properties. Flaxseed is very versatile and can be incorporated into various parts of the meal, such as baked products, meat patties, pastas, breads, dairy products, and various snacks and beverages. It is important to note that it must be ground to be digested, but that can be easily done during manufacturing, or it can be done at home if you have a food processor like a spice grinder. Next is chicory root. And chicory root is a perennial herb native to England, but is now naturalized throughout Europe, North America, and Australia. It is one of the best sources of inulin-type fructans, which are prebiotics not digested in the upper GI tract. Like other prebiotics, rather than being digested or absorbed in the small intestine, inulin-type fructans pass through this large intestine, where via fermentation, they form short-chain fatty acids, which are the major energy source for cells within the colon. Inulin is frequently found in low-fat or dairy-free yogurt, ice cream, and ready-to-drink protein shakes, sometimes used in bread or other baked goods to replace gluten. It is cheap to manufacture and has a sweeter taste, so food manufacturers often use it to increase the flavor of food instead of using sugar, carbs, and fat. Chicory root has been shown to improve glucose tolerance, improve absorption of magnesium and calcium, promotes bowel regularity, and increases healthy amounts of healthy bacteria while reducing levels of pathogenic bacteria in the colon. Oat byproducts are used or added to a wide variety of foods, such as breads, pastas, biscuits, cookies, snack bars, and breakfast cereals. Our oats are a natural source of micronutrients and potentially cancer-fighting phytochemicals, including resistant starch, vitamin E, zinc, phytic acid, lignans, flavonoids, and beta-glucan. 25% of the total starch in oats are also a source of avenonanthramides, which is a compound with anti-inflammatory and antioxidant activity. Algae has been used for years as a source of a thickening agent, but are increasingly being considered as a functional food. Nutritional values of algae vary by species, but the protein quality of some forms of algae is good as that of eggs. Algae is being added to foods such as salad dressings, liquid condiments, beverages, baked goods, and baked goods. Platonic algae are the predominant source of omega-3 fatty acids in fish and provide both EPA and DHA. And DHA may influence carcinogenesis by enhancing anti-inflammatory actions and inducing cell death. Ongoing research is being done regarding DHA in cancer. Resveratrol itself is not considered a functional food, but more so a compound that would be found in functional foods. Resveratrol is a natural compound that plants produce to protect themselves from the environment. It has antioxidant properties that may have various effects in the human body, such as expanding blood vessels, lowering blood sugar, and fighting disease. Also, it's being investigated for its anti-carcinogenic effects. It is often found in foods such as red grape skins, berries, red wine, and peanuts. Resveratrol is also available in supplemental form. However, it is used to be used cautiously when taking blood-thinning medications, as it may cause excessive bleeding. Now I'm going to turn the time over to Maddie, who will be talking more about nutrition supplements.
Thanks, Angie. So like Angie said, I'm going to kind of gear towards supplements instead of whole foods now. So kind of to just put a general disclaimer out there, supplements are poorly regulated and they don't always provide what they claim they do. Therefore, these should not replace nutrient-rich foods in our diet. So this was the second quiz question about, using supplements over food. So we really want to focus on eating whole foods, getting these vitamins and these minerals and all these really great things from our foods before we start supplementing them. There is a time and a place for these, absolutely. So we're kind of going to dive into a few more of the supplements here. So the use of dietary supplements is widespread, particularly among those with cancer, and many studies have reported that the use of dietary supplements by cancer patients is much greater than by people that are cancer-free. So some of the supplements, there's a wide variety of lists out there, and so we're kind of just going to, like I said, touch on some of them, but they include vitamins, minerals, herbs, botanicals, amino acids, enzymes, metabolites, and organ tissues. So kind of what is the definition exactly of a supplement? So they are products taken by mouth that provide ingredients intended to supplement the diet. They may include vitamins, minerals, all those things that were listed on the previous slide. The FDA, the Food and Drug Administration, does not verify that nutrition supplements contain what they say they do, or whether they're contaminated with heavy metals, bacteria, pesticides before they're sold. So there are some third-party organizations out there that have kind of taken upon this role. And some of these organizations are listed here on the slide. So the USP, NSF, verify certain products on their websites, as well as the consumerlab.com is a really good one to kind of go in and dive into a little bit more of the nutrition facts of these supplements. So even if a supplement has been certified to show that it contains what's on the label, there still is a risk for some side effects. So just kind of a general disclaimer, supplements are not regulated and therefore shouldn't be taken or should only be taken after discussion with your doctor as well as your dietitian. So we're going to kind of dive into the specific supplements. And so this has kind of been structured to kind of like each slide has 3 different parts to it. So you'll see kind of on the first one, kind of how I've organized them. So the first is ashwagandha. And its anti-cancer benefits are inflammation, pain, anxiety, and energy. Some of the concerns associated with using ashwagandha are it augments thyroid function and can cause some GI upset. GI upset tends to include nausea, vomiting, diarrhea, constipation. So a little bit of background on this. It's also called Indian winter cherry or Indian ginseng, and typically found in parts of Africa and the Middle East. Its overall big claim is stress reduction and anxiety relief. And it has been shown to kind of, like I said, help with the inflammation, pain. And then regarding anxiety, it has been shown to kind of normalize the cortisol level, which is what we associate with our stress response. Next, we have black cohosh, and its anti-cancer benefits are reduced risk of breast cancer, as well as suppressed symptoms associated with menopause, specifically hot flashes. Some concerns is it may interfere with conventional cancer treatments, particularly tamoxifen, which is used to prevent and treat breast cancer, and it may increase toxic effects of doxorubicin and docetaxel, as well as some of the GI upset like we talked about on the previous slide. So due to these mixed results, more research is needed to assess the relationship between black cohosh and hot flashes, as well as with breast cancer. Next, we have coenzyme Q10, commonly called CoQ10. And this is a fat-soluble bioactive substance found in every cell in the body. It's also an antioxidant involved in cellular energy production. So its anti-cancer benefits are reduction in renal toxicity and cardiotoxicity of doxorubicin, so what we talked about on the previous slide. And this is a type of chemo used to treat multiple different types of cancer. It may have some procoagulant effects, thus influencing the efficacy of warfarin. And so if anybody is taking warfarin, it's contraindicated to take coenzyme Q10 at the same time. As with other antioxidants, there's concern that coenzyme Q10 could interfere with chemotherapy treatments, and this interaction hasn't been confirmed yet. Although because there is some concern, like we talked about, it's important to, mention this to your doctor before you do start taking this. Next, we have curcumin, which is a naturally occurring polyphenol found in the turmeric plant, which naturally grows in India and tropical regions of Asia. It's derived from the plant's ribosomes and is believed to be the active component in the turmeric spice. Its common claim or anti-cancer benefits are antioxidant properties and anti-inflammatory. And it has been shown to exert therapeutic effects in many types of cancer, including lung, cervical, prostate, breast, osteosarcoma, and liver cancers, as well as esophageal cancer and gastric cancer. Some of the concerns is poor solubility and low bioavailability. So emerging research suggests that curcumin should undergo further study for anti-cancer effects, but at this time, evidence is insufficient for recommending it, specifically for cancer treatment. Next, we have DIM and I3C. So DIM is a naturally occurring plant alkaloid bioactive metabolite of I3C, sorry. This is typically found in cruciferous veggies such as broccoli, cauliflower, Brussels sprouts, cabbage, kale, bok choy, mustard greens, and turnips. Some of the benefits that has been shown are proposed cancer chemoprevention activity, as well as it can increase the efficacy of other drugs, and has an effect on prostate cancer cells. So concern, it may interfere with hormone therapy. Overall, DIM has been shown to be well tolerated, so there aren't any side effects shown to be taken. Next, we have garlic, and some of garlic's common claims are boosting immunity, having some anti-inflammatory properties, and it also has been used for cold and flu symptoms as well as prevention. Claims to have the most benefits from consuming raw garlic due to heating and changing its pH. So some of its anti-cancer benefits is it may stimulate apoptosis. Apoptosis, once you break that down, it essentially just means programmed cell death. So Angie talked about this on one of her earlier slides, I think the algae slide, the cell death. So the wording on my slides, I'm going to say apoptosis. What that is just the cell death. As well as associated with risk of lower having gastric cancer. So some of the concerns is it may interfere with the function of some prescription drugs, particularly anticoagulant drugs. The VITAL study found that there was no association between garlic supplements and prostate cancer risk, and use of garlic pills increased colorectal cancer by 35%. Garlic contains compounds that show potential as anti-cancer treatments. However, current evidence is insufficient for recommending garlic supplements for this purpose. Next, we have ginger, and its common claim is to help treat and alleviate nausea. Therefore, the first anti-cancer benefit is helping to ease those GI upsets. So nausea, heartburn, has also been shown to kind of help treat some anorexia or lowered appetite, food intake, diarrhea, and gas, as well as nausea specifically associated with chemotherapy. Evidence examining the effect of ginger on nausea and vomiting associated with chemo is mixed, and current evidence is insufficient for confidently recommending ginger supplements for antiemetic treatment. Ginger may interfere with the activity of some anticoagulant drugs, but evidence is uncertain at this time. And the US Food and Drug Administration, the FDA, generally recognizes up to 4 grams of ginger can be consumed daily, and that's safe level. Although a lot of the studies that have been done on ginger usually have been done with amounts less than the 4 grams per day. Next, we have ginkgo biloba. And the seeds and leaves of the slow-growing tree are a source of many bioactive compounds. Extract is generally dried into a powder and formulated into a pill, tablet, or capsule for ingestion. And then the common claim with ginkgo is its antioxidant properties, as well as helping with inflammation, improving brain function, reducing anxiety and depression. So the anti-cancer benefit is may inhibit proliferation of cancer cells. And then some of the concerns would be side effects are uncommon, many increase bleeding risk, but evidence is inconclusive on this. It also has been raised to be a concern that it may interfere with the activity of some medications, in particular anticoagulant drugs and anti-seizure medications. So at this time, evidence is insufficient for recommending this supplement specifically for cancer treatment. Next, we have green tea, and the active constituents of this plant have been shown to possess hepatoprotective, cardioprotective, neuroprotective, anti-cancer, anti-obesity, anti-diabetic, antibacterial, and antiviral, as well as hypoglycemic effects. So some of the benefits listed for this are the active form of this plant has shown to be protective against many of our organs, as well as it's impossible to damage the liver under traditional tea drinking conditions. And some side effects are nervousness, anxiety, heart irregularities, tremors, hypotension, restlessness, insomnia, irritation of the GI lining, diuresis, and daytime irritability are some possible side effects at like extreme levels of consumption. That being said, studies of green tea and cancer in animals have shown consistently positive results, but studies in humans are much less consistent and have shown some of those conflicting results, like I mentioned, with some of those side effects. Next, we have 2 different kinds of mushrooms I'm going to talk about. So the first is the reishi mushroom, and this is a bitter fungus with a glossy exterior and woody texture. It's the most studied mushroom with respect to liver protective effects. It is usually dried and taken as an extract in the form of a liquid, a capsule, or a powder. And so some of the anti-cancer benefits are the apoptosis, so that programmed cell death, as well as fatigue. And then some concerns is powder form for taking greater than 1 month. So results from a small clinical study show that taking the powder form can improve cancer-related fatigue. Greater than a month, it is not shown to be effective. And then the second kind of concern with that is the bleeding risk. So bleeding particularly combined with high doses of anticoagulant medications. And so for the reishi mushroom, there is no sufficient evidence to justify the use of this as a first-line treatment. It could be administered as an adjunct to conventional treatment, considering its potential benefit for enhancing tumor response. And then next we have turkey tail, so the bottom picture on this slide. And results from numerous studies and clinical trials confirm it inhibits the growth of cancer cells as well as decreases cancer treatment-related side effects such as fatigue, loss of appetite, nausea and vomiting, as well as pain. And there appears to be protective against the adverse effects of radiation. A meta-analysis has provided strong evidence for the benefit in cancer patients, particularly those with breast cancer, gastric cancer, and colorectal carcinoma. In regards to concerns, there are no concerns. It's generally safe and very well tolerated. Next, we have N-acetylcysteine, also called NAC, and this is an antioxidant, and it improves the utility of chemo by enhancing the cytotoxic effects of chemo agents and by protecting the host tissue against their toxic effects. In regards to this one, concerns, there's really none. It's generally well tolerated as well as the turkey tail and has a very safe profile with minimal side effects. Side effects, if any, have been seen with doses greater than 9 grams per day. And the frequent dose range, if you were to buy this, would be anywhere from 600 to 1800 milligrams per day. So a lot less than that 9 grams that could potentially cause some side effects. Next, we have St. John's wort, and this is a yellow flower used as an herbal remedy. It may make cancer cells more sensitive to photodynamic therapies. And in the VITAL study, which I also referenced earlier on one of my slides, it was shown that its use was inversely associated with the risk of colorectal cancer. Preclinical studies indicate a potential use for St. John's wort for medical pain management. In regards to concerns, it may interact with many medications, including warfarin. So we want to make sure that we are avoiding St. John's wort with all concurrent chemotherapy due to possible effects of enzyme reducing induction for multiple enzymes. At this time, current evidence is insufficient for recommending St. John's wort as a cancer treatment. Next, we have vitamin D, and this is a fat-soluble vitamin with anti-inflammatory, immunomodulatory, bone protective, and anti-cancer effects, and it is commonly called the sunshine vitamin. People living in geographic areas with greater sun exposure have lower cancer rates because of this. There has been found to be an inverse association between cancer and vitamin D levels, strongest for colon cancer, and some studies have shown for breast cancer as well. In regards to the decreased risk for breast cancer, this is seen mostly in postmenopausal women compared to premenopausal women. And concerns for this are toxicity. So if you're taking too much, it can result in hypercalcemia or elevated calcium in the blood. The dietary reference intake for vitamin D suggests an upper intake level of 4,000 international units per day. One big misconception is that we all need supplements. So unless you have a known history of a specific vitamin deficiency or are at risk for one because of treatment or the cancer itself, it's best to get your nutrients through food, or in this case, going outside, spending some time in the sunshine. Next, I'm going to talk about antioxidants. So antioxidants are specifically cancer-related antioxidants are vitamin A, C, and E, as well as selenium and zinc, as well as some enzymes that are absorbed and attached to free radicals, which are destructive molecules, and they prevent them from attacking our normal cells. They can potentially decrease negative effects from radiation and chemo that rely on free radicals, and it may come at the cost of increased return of disease and death. So to ensure that cancer treatments are as effective as possible, high-dose antioxidant supplements are not recommended during treatment. Next, we're going to talk about multivitamins. Your doctor may prescribe a multivitamin to you, and it may be best to choose a supplement with no more than 100% of the daily value of our vitamins and minerals. as well as one without iron. So we want to make sure that, you know, as with everything else we've discussed today, that we're talking to the doctor before you start taking any of these things. Many vitamins and minerals have an upper limit set at a level that is hard to reach with food alone. So that's why we encourage, you know, healthy, balanced food intake, because we're not going to kind of exceed our daily nutrient needs of any of these things. When we start supplementing things, and we're getting too much of a good thing, that's sometimes when some side effects come into effect. So overall, eat your foods instead of trying to supplement them. And then kind of our main takeaways from this, like I just mentioned, eat whole foods. And then Andrea and I have both talked about a lot of different, you know, foods and supplements and things. And kind of the biggest takeaway we want you to take from this is that no one food can cure cancer. So we've talked about a lot of really good things, but there isn't, unfortunately, one thing out there that's kind of the cure-all. And then if you do want to kind of dive into a little bit more, we got a lot of our information from these really great resources. So the first, Intermountain Health is a great resource, you know, your doctors and all of your providers. If you follow this website, that's the second one listed on here, it'll have a link to a bunch of different short videos that are on different kind of hot topics in nutrition, specifically regarding cancer. And then next is the American Institute for Cancer Research. Lots of really great resources, recipes, ideas, updated information, and studies on there, as well as the American Cancer Society has kind of all those same things. The Dietary Guidelines for Americans, Angie mentioned earlier in the presentation, kind of go over the different recommendations. They're done every 5 years. And then last is the Academy of Nutrition and Dietetics. So thank you for being here today. We appreciate your time on this topic. If you do want to check in for future events coming up, you can go to this website listed here. We'll have updated kind of the next few presentations. So our next presentation will be on cancer and nutrition misinformation. And this will be February 8th at 5 p.m. And then next year, we will have our first presentation that will be on nutrition for cancer prevention and survivorship. And this will be April 11th at 2 p.m. If you aren't able to tune into these, that's totally okay. These are recordings. And so, you know, as you're watching this recording, we hope you are able to come back and, you know, watch these recordings in the future if you aren't able to watch the live recordings. If you would like to, we would love your feedback on this. So if you want to use your phone camera, you can scan this QR code. There's just 7 brief questions that'll kind of help us in our future presentations, help, you know, give the best information of what you all are looking for. If you do have any more questions, please use this email listed on the bottom of the slide, and one of our dietitians will be sure to get back to you. Thanks.